With Libby Znaimer on Zoomer Radio with guest host Jane Brown.
Libby returns tomorrow. She kindly stepped aside today to grant me an opportunity to talk about my favorite charity during this Bladder Cancer Awareness Month. It's a bittersweet segment for me since my mom, Sandy, died with bladder cancer back in 2012, so I advocate for Bladder Cancer Canada in her memory. Joining me as they do every year, Ferg Devins, bladder cancer survivor and chair of Bladder Cancer Canada, and Dr. Alexandre Zlotta, director of Uro-Oncology at Mount Sinai Hospital, professor in the Department of Surgery Urology at the University of Toronto, and member of Bladder Cancer Canada's Medical Research Board. Ferg and Dr. Zlotta, welcome to both of you.
Hello, Jane. Nice to be here.
Ferg, hello. Well, my feeling, Ferg, is that more people have become aware of bladder cancer in recent years because of the incredible work of your team at Bladder Cancer Canada. People are seeing the bus boards and the billboards, which are really striking and send home the message that if you see blood in your urine, see your doctor.
Yes, it's certainly one of our primary campaigns is the See Red, See Your Doctor campaign. Currently, it's the image of a lemon being squeezed, and it's a drop of blood. Mm-hmm. And the point there being is a lemon should be yellow, and so your urine should be yellow. So if you see blood in your urine, you should see your doctor. And I think the most important thing to reinforce, particularly during these COVID times, Jane, if it happens once, you should call your doctor. And I'm sure that Dr. Zlotta would reinforce that.
Well, right. Dr. Zlotta, what is the first thing you do if you see blood in your urine even once?
I think, as Ferg said, you absolutely have to consult. Don't neglect. And I'm going to repeat what I said last year, which is I really think that the hospitals are the safest places in our entire country and province. Basically, nothing happens. The screening is so tight that nothing happens. So you carry and risk nothing by consulting.
And by the way, I have Ferg and Dr. Zlotta until 1 o'clock. If you have a loved one who has bladder cancer, if you have bladder cancer yourself, if you have any concerns, you'll want to grab a line for this segment. The numbers to call are 416-360-0740, toll free 1-866-740-4740. Dr. Zlotta, you would know this better than anybody during COVID. If you're seeing blood in your urine and you've told your family doc about it, you may not be able to see a urologist right away.
Yes, but on the other hand, honestly speaking, I think we all, and I speak on behalf of all my colleagues, have done the extra work and went the extra mile to be able to see patients and people in that condition. And so, to the best of my knowledge, in terms of diagnostic workup, everything has been done to really optimize. We live in unprecedented times for sure, but by far and large, we've been able to help people who presented with, blood in the urine, for instance. Yeah.
Now, when it comes to diagnosis, Ferg, there are two types of bladder cancer. Can you get into that for us?
So non-muscle invasive bladder cancer, and that's what I had back in 2014. That was two tumors that were on the inside of the bladder. They were really inside the surface of the bladder, and so I had what the procedure called TURBT, which is basically to go in and surgically I was put under, and they remove those tumors from inside the bladder, scrape them out, if you will, make sure they've got all of the margins of the tumors. Now, I was high grade, so following that, I underwent up to 18 treatments of a treatment called BCG. People can see the explanation of that on our website at bladdercancercanada.org. So that's non-muscle invasive bladder cancer. I still have my bladder. I was very fortunate, and touch wood, since 2014, I've been all clear ever since. The other is invasive bladder cancer, and oftentimes that's when the Dr. Zlotta likes to call it the tiger versus the pussycat, and it becomes very aggressive, goes into the wall of the bladder, can be penetrating the wall of the bladder, and that's when the bladder has to be removed through what's known as a radical cystectomy. And then Dr. Zlotta can probably enlighten us on some of the options that patients would have with respect to urinary diversion if the bladder is removed. There's also metastatic bladder cancer, and I raise that because I unfortunately lost a friend just last week to metastatic bladder cancer.
Oh, Ferg,
he
I'm
succumbed to that
sorry.
disease. Yeah, he had a kidney removed 3 years ago, and as it turned out, it was bladder cancer, and that kidney, it was metastatic bladder cancer. So, I think it's important. The big thing here is you catch it early. I was very fortunate. I had some strange back pain. I went to my doctor, had a CT scan. It showed something in the bladder. I was off to see my urologist at Sunnybrook Health Sciences, and they caught it early, and I got them out of there. And I still have my bladder today. So if you see blood in the urine, for gosh sake, folks, you make sure you call your doctor.
Dr. Zlotta, let's talk about the alternatives for those who've had invasive bladder cancer and need to have their bladders removed. My mother was one of those, and she was living quite normally for a year until we realized that her bladder cancer had actually traveled to her lungs and other parts of her body. And once that happens, survival, it is almost negligible. There are some cases where people do survive, and I know that has changed a lot since 2012. So talk to us a little bit about how that all works once you lose your bladder to cancer.
So, first of all, let me just emphasize, and Ferg is absolutely right, that what has changed a little bit compared to probably 15 years ago is that not every single tumor, which is a tiger and that invades into the muscle, needs necessity now to be removed with the bladder. Most do, but we have what's called a bladder preservation program where tumors which are less than, say, 3 inches, which are isolated and single, not multifocal, and that don't push on the ureters, we can actually do what's called trimodality therapy, where the tumor is resected, like Ferg had his entire bladder tumor shaved, and this is then accompanied by a short dose of chemotherapy, low level, and then radiation therapy on the bed of the resection. And we showed a couple of years ago that at 5 or 10 years follow-up, the results were equivalent for a subset of patients who fell into this category. And we're actually expanding with a large multi-center in North America to prove this further. So I think the reassuring news is that in the past, yes, it was always the removal of the bladder. Now it's not necessarily, and this should be discussed. Now,
Amazing.
If the bladder has to be removed, either you reconstruct a new bladder using bowel. This is called a neobladder with small bowel. This works usually in men and women who are reasonably young, not because you can't do it later after the age of 70, 75, but simply because the sphincter is a little bit weaker with age, and therefore the risk of incontinence above a certain age is high. Mm-hmm. Or, depending on the location of the tumor and the type of tumor, one actually reimplants the two ureter in a piece of bowel that is actually then brought to the skin. That's called an alveolar conduit. Or in some circumstances, we're able actually to do a pouch of right colon, which can be catheterized through the umbilicus, and that's called an Indiana pouch. So there's a variety of ways to divert the urine from continent to non-continent. But the key message is that in contrast to what people would anticipate, and logically, the quality of life of people who underwent that surgery is surprisingly good, and humankind adapts to a new situation, and that's really the key message.
It's Bladder Cancer Awareness Month, and joining me, Jane for Libby here on Zoomer Radio's Fight Back, Dr. Alexandre Zlotta and Ferg Devins. of Bladder Cancer Canada. Dr. Alexandre Zlotta is a foremost Uro-Oncology expert here in the city of Toronto and also a member of Bladder Cancer Canada's Medical Research Board. We do have some calls. We have some Zoomer Radio listeners who want to speak with you both. Since it is Bladder Cancer Awareness Month, Ferg, let's talk about where bladder cancer is falling in the lineup of cancers in Canada, how many people get it each year, and survival rates when it's caught early.
So we've got somewhere around 11 to 12,000 patients that would be diagnosed in a given year across the country. We say that our community is about 80,000 bladder cancer patients across the country. And in fact, Jane, we have about 7,000 subscribers to our Bladder Cancer Canada newsletter. So in the Awareness Month of May, Bladder Cancer Awareness Month, really we have two purposes for awareness. One is to raise public awareness about the disease because, as you asked, it's the fourth most prevalent cancer for men in Canada and 12th for women, making it the fifth most prevalent cancer overall. So we really need to get the word out there. So that's important. The other important thing is that we at Bladder Cancer Canada are here with some plentiful resources to support those patients along their journey. After they leave that doctor's office, oftentimes there are questions that are not medical questions, but it's really lifestyle questions. How do I tell my family? How do I now plan for my journey? What's this thing they call cystoscopy? There's a number of questions that the patient has in mind, and we have the resources to support those patients, whether that's online through our discussion forums at bladdercancercanada.org or through Twitter, Facebook, Instagram, and our YouTube channel. We also have patient guidebooks on our site. So we're trying through Bladder Cancer Awareness Month and hashtag Bladder Cancer Aware to attract as many patients across Canada as possible to join us at Bladder Cancer Canada.
Excellent. All right, what we'll do is take a quick break and then get back to your phone calls. I'm inviting you till 1 o'clock. If you have bladder cancer, if you have a loved one with bladder cancer, Dr. Alexandre Zlotta and Ferg Devins are here to answer your questions. Here are the numbers again, 416-360-0740, toll free 1-866-740-4740. Your questions and answers coming up next.
Libby Znaimer on Zoomer Radio with guest host Jane Brown.
It is Bladder Cancer Awareness Month. I've been an advocate for Bladder Cancer Canada since 2015 in memory of my mom who died with the disease in 2012. And joining me, two gentlemen who have become friends over the years, Ferg Devins, bladder cancer survivor and chair of Bladder Cancer Canada, and Dr. Alexandre Zlotta, director of Uro-Oncology at Mount Sinai Hospital, professor in the Department of Surgery, Urology at the University of Toronto, and member of Bladder Cancer Canada's Medical Research Board. I'm looking forward to them helping you out here with your questions. Let's go to Beverly in Hamilton. Beverly, go ahead.
Hi. Last September, my husband was blood measuring, and he was diagnosed with mild bladder cancer, but it was also the prostate, and so they did 2 TURPs and 2 BCGs. By the time they were finished that, which was in March, it had gone into the muscle.
Mm-hmm.
Then now it has gone into the pelvic wall. Now, I feel that there was too much time lapsed between what they were doing. Now, he does have Parkinson's, and he has atrial fibrillation.
So what is your question for the doctor, Beverly?
Should they be taking the bladder out when it's gone that far? They're going to do tests or radiation and chemo, but I'm wondering, should they be taking that bladder out?
Okay, Dr. Zlotta, you've heard Beverly's story. What are your thoughts?
So, and first of all, I'm really sorry to hear that, and crossing fingers and toes for the best response to the combination of chemo and RAS. what I can tell you is that, when the disease is high grade but still not invasive, the BCG is actually the standard of care. And so BCG is an immunotherapy. And it actually takes time for BCG to work because it really boosts the immune system to recognize tumor cells and to kill them. And you're absolutely right. The big dilemma that many urologists face is that a substantial amount of patients will respond to BCG and therefore avoid the progression to muscle invasion, and this can be north of 75%. And that means that if you remove the bladder in those people, by definition, you overtreat. But at the same time, it happens, and that's really sad for sure, that people, despite the BCG, because it takes time, will invade and progress. And so it's a very, very difficult call. It's a call between overreacting and underreacting. The good news that I would like to share with you is that in the past, especially after one BCG, when people did not respond to BCG, the only way to deal with that was to remove the bladder. But since probably 2 years, we have a truly flurry of new treatments which are effective. It can be from the combination of two drugs which are instilled in the bladder, like docetaxel and gemcitabine. It can be by using what is called the immune checkpoint inhibitors that were initially given for people who had the disease outside of the bladder, but where we realized that giving atezo, durvalumab, or nivolumab was able to actually maintain the disease confined to the bladder in a substantial number of patients. It can actually be with new compounds which are instilled in the bladder. One of them is Adstiladrin, where it's actually a virus that will literally bring a bomb of interfering alpha and then kill the cells. So as much as I really genuinely sorry for what happened to your husband, I think that the future seems to be bright for many other patients.
Beverly, thank you for calling. All the best to you and your husband.
Thank you.
Ferg, it's really encouraging to hear Dr. Zlotta talk about all this great research. And I know that's a big part of what Bladder Cancer Canada does as well, is helping to fund research with donations from the annual walk.
Yes, our mandate is first and foremost to support our patient community, secondly, to raise awareness, and thirdly, to fund research. And, we are so fortunate to have people such as Dr. Alex Zlotta here in Canada, in Toronto. He's world known in this field, and we're fortunate that we have many of our researchers and medical professionals across the country, Jane, who are such individuals in the space of urology and oncology. And what's fascinating is that we now share a world platform through the World Bladder Cancer Patient Coalition, where we work around the world to really make a difference. And so funding research is critical. In Canada this year, Bladder Cancer Canada, thanks to our donors, thanks to our supporters, thanks to those who support us during our walk, is putting forward $100,000 for research, and the Canadian Urological Association is matching that with another 100,000.
Fantastic.
So this year, we will have 4 $25,000 research grants and 2 $50,000 research grants to get out to our research community in Canada to continue the fine work that Dr. Zlotta is pointing to and to continue to make breakthroughs in the fight against bladder cancer.
Wow. A big smile on my face. That's great news. Great news to hear, Ferg. Let's go to Annette in Mount Forest. Annette, do you have a question for Dr. Zlotta?
Hi, Jane. I'm a first-time caller, and my husband has bladder cancer since October 2018, and he's wondering about, he's just finished the BCG treatment at the end of April, and on May 6th he got his Pfizer vaccine. Is there any problems with interactions between the two? Is one going to nullify the other?
So 2 things. First of all, the short answer is absolutely no interaction between the two. absolutely none, and so that's probably something safe to remember. Now, it's even better than that. BCG has been studied, and actually we've been doing a study here in Toronto, where there has been some evidence that when people are vaccinated against tuberculosis with BCG, and that could also be the case when they receive intravesical BCG, although this is to be proven, the BCG working as an immunotherapy literally stimulates part of your immunity, which is called trained immunity. And what does that mean? It means that it teaches the body to recognize viruses or other dangers which are completely unrelated to the BCG vaccine, but where the immune system is boosted to the point where you can fight off unrelated viruses. Among them may be COVID. And so there's a lot of research to show that not only has it gotten zero interaction with the classical vaccines, but if anything, there is maybe a possibility that it would actually improve the immunity of people who got the BCG.
Annette, is that helpful? Good. Thank you.
Yeah, that's great news. Thank you very much.
Thank you for calling. I think, Dr. Zlotta and Ferg, we have time for one more call, just a few minutes left here. Ron in Georgina. Ron, go ahead.
Hello there. Yes, I had my operation 2 months ago, and now I've had my treatments for immunotherapy. Mm-hmm. What is the next treatment after that?
Dr. Zlotta.
So your disease was a pussycat or something completely superficial, correct?
No, I think he said it's aggressive, but it's not in my muscle.
Not in the muscle. So normally for what's called a high-grade non-muscle invasive tumor, the way it works is that you receive your BCG 6 weekly installations, and then you're going to be monitored every 3 months with a cystoscopy for 2 years. And then every 6 months for
I've got to go in June the 2nd for my first look at me and I guess you'll know then.
Exactly. And at the same time, studies have shown that giving only the BCG 6 weekly installations in aggressive disease is not enough. You really need, like many vaccines, boosting. And that's why in addition to the first 6 weekly installations, you will be advised by your urologist to have what's called maintenance BCG, which is given once a week for 3 weeks during 3 years. And usually it's every 6 months. The first one is 3 months and then every 6 months. And so basically it's reboosting your immune system to recognize and kill the tumor cells.
Okay, thank you very much.
Okay, thank you, Ron. All the best to you with your therapy.
Thank you. Bye.
So as we wrap up this segment for another year during Bladder Cancer Awareness Month, I'd just like to get final thoughts from both of our guests, Dr. Zlotta, Ferg, Devins. Ferg, we talked about, the importance of, if you see blood in your urine even once, to reach out to your doctor. In terms of prevention, bladder cancer prevention, lifestyle, all of that, what goes into trying to avoiding contracting bladder cancer?
Well, we know risk factors. Certainly smoking and other tobacco use is number one. We have information that past radiation exposure may be another risk factor. Chronic bladder inflammation is another one. Possible exposure to chemicals, especially in the workplace, could be another one. And lastly, parasitic infections. So I guess the one that we really caution people the most on is smoking. I was a smoker back in my youth, and that's probably why I had bladder cancer. So, really smoking is probably the one that raises most attention, I think, for people.
Dr. Zlotta, final comments, just some reassurance for people who may be going through bladder cancer diagnosis and treatment.
So 2 things. One is that I fully agree with Ferg. I think we'll have to be in the future a little bit careful about pot smoking. A lot of people are now doing it. So it remains to be seen whether, this is not eventually a risk factor to be monitored. I would err on side of caution. The final comment is that since now 9 years that unfortunately your mom passed away, we have seen the most incredible revolution that I would never ever had dreamed when I started my career over 3 decades ago. And I think it's always not fast enough, but there is such a flurry of new treatments to preserve the bladder. Even when the disease went outside, it doesn't respond to chemotherapy. There is such a breadth and wealth of competence in our country that I am actually pretty optimistic that every year when we get together, I'll be able to come up with even more reassuring news for people with the disease.
That is where we will leave it for this Bladder Cancer Awareness Month. And for any information on support from Bladder Cancer Canada, go to bladdercancercanada.org. Ferg and Dr. Zlotta, thank you both so much.
Wishing you well, Jane. Thank you. Thank you, Doctor.
Be well. Always a pleasure.
It is always a pleasure. Thank you both. Stay safe. Ferg Devins, bladder cancer survivor and chair of Bladder Cancer Canada, and Dr. Alexandre Zlotta, director of Uro-Oncology at Mount Sinai, professor in the Department of Surgery, Urology at the University of Toronto, and member of Bladder Cancer Canada's Medical Research Board. Jane for Libby. She will be back tomorrow. Have a great day.
Fight Back with Libby Znaimer is produced by Zeev Hadi, with technical production by Jordan Chakravarti and Jeremy Logan. Check out the Fight Back podcast anytime at zoomerradio.ca or wherever you get your podcasts.
This is Zoomer Radio